Hey functional movement professionals, we all know how much the anterior hip and hip flexor group can get restricted and how that can lead to all kinds of functional and structural pathologies. I would like to invite you to consider an even deeper issue that can cause those hip flexors to stay locked into flexion and not have full function and mobility. So one of the body's main concerns is protecting our vital organs and our central nervous system. Oftentimes from lack of motion, poor diet, or lack of emotional processing, the attachments of the ascending and descending colon can get restricted within the pelvis. If the restrictions around the large intestine aren't addressed, all of the great work that we're doing to restore motion in the front butt will not be nearly as effective as it could be. In fact, if more motion could lead to damage or strain or tearing in the organs, our proprioceptive and central nervous system is going to kind of shut down the motion to those areas to avoid injuries to one of the most vital parts of the body. So let me give you an example of how to work with and release these lower aspects of the ascending and descending colon to improve your function. So if I take my prop here as part of the colon, as it comes out of the small intestine here, just medial to the anterior aspects of the ileum, it's going to run up here before it takes a curve at what we call the hepatic flexure. So in function, as we go into extension, our colon is going to lengthen out, our ascending colon. And as we go into rotation to the right, it's going to twist a little to the right and to the left. So if we get some restrictions down here in the ligaments and some of the fascia that can get a little bit stuck around the lower colon, and also if we don't have any proprioceptive stimulation in there, the body is going to want to shut that down. So what we can do to release that is just kind of bend at your knees, not at your waist, but at your knees, and I want you to take both of your hands and kind of create a little bit of a scoop and reach just inside your ilium and grab right there above your pubic bone. Just kind of reach in and grab the tissue of the colon and just pull up and give it a little bit of a stretch. Now as soon as you feel that stretch, I want you to stand up and straighten your knees and go into extension. Then I want you to stand up and go into extension with right rotation. And then of course, stand up, extension with left rotation. So do each of those movements 3 or 4 times and really get a nice sense of awareness down there in your colon. And get that all opened up. Get that released into extension. And now, notice once you've done that, just take a little bit of a walk for a second and you're going to notice that your hip flexor group and everything around your quads, everything is kind of loosened up a little bit. And you'll notice that your proprioceptors have been stimulated so much, you're going to notice a little bit more stability on that side compared to the left side. So instead of being uneven, let's go ahead and do the left side as well. So there's a little bit different structure on the left side, so go medial to your hip and just take your fingers in there again, bend your knees, grab part of that descending colon as it goes and turns in, and just give it a nice little stretch and a lift, and then straighten your legs and go into extension. Come back down, straighten your legs, go into left rotation, pick it up again and go into right rotation. Do that each time about 3 or 4 times to ensure a really good release in there. And then go for a little bit of a walk and notice how that feels now. You're going to notice a lot of awareness in your lower abdomen, and it's going to be much easier for you to go into extension. So you're going to notice with a lot of your clients and your athletes that their performance and their ability to have most stability or stability is going to be greatly increased by opening up the lower parts of the large intestine. If you want to learn more about the structural and functional implications of not only the large intestine, but of all of the organs, and how to utilize this with your clients for greater mobility, stability, and health, come to our Visceral Dynamics training. You'll learn a new way of looking at the viscera in the body from a structural, functional, and energetic perspective. Visit Trunamics.com and click on the upcoming trainings button to find the next class. We'll see you there.